Hello everyone, myself Shanaz and I welcome you all to my channel Nurses, the Heart of Healthcare. Keep learning, keep growing. In this video, we are going to discuss 35 MCQs, multiple choice questions and their answers related to the topic vital signs. As we all know, vital signs is a very important chapter that we have learned in fundamentals of nursing in our first year, may it be BSc or GNM. Yes, and it's very important for us to know and understand and remember it, maybe as a student nurse or as a working staff, because these are the body's vital parameters. Yes, based on these only our clinical decisions relies. Okay, the treatment is based on. So it's very important. Vital signs, these are the measurements of the body's basic vital functions. Okay, so it's very important for us to know. These 35 MCQs are very simple questions. I hope you'll find it very easy to answer, and these MCQs will be surely helpful to you if you are preparing for a quiz competition or for any competitive exams for your nursing jobs. Okay, so hope you'll find it interesting, helpful, and you all participate in this. Okay. One important thing in MCQs is they never ask direct questions. Okay, like what is a normal body temperature, what is a normal pulse rate, what is a normal respiratory rate. They never ask direct questions. The questions will be turned around, okay, to confuse you, and the choices will be like every choice will appear near to right. Okay, so we have to read the question properly, understand it before ticking the right answer. Okay, so let's begin. These are very simple questions, but okay, so let's begin. The first question is, an elevation of the body's temperature above normal is labeled. The options are pyrexia, hypothermia, hypertension, or afebrile. See, afebrile is when the patient is when the person is not having fever. There is no fever, it is afebrile. Hypertension is high blood pressure. Hypothermia is when the temperature is low. Okay, body's temperature is low. Pyrexia is when the body temperature is high. So what is the right answer? Pyrexia. This is the medical term used for fever. Okay, so an elevation of the body's temperature above normal is labeled as pyrexia. Pyrexia is the right answer. Okay, the next question. When assessing a temperature rectally, the nurse would use extreme care when inserting the thermometer to prevent which of the following? Okay, when we are checking temperature rectally, we have to be very careful. Why? Okay, because they have given the options. It can increase the heart rate, it can decrease the heart rate, it can decrease BP, or it can increase respiration. What is the right choice? Come on, answer. See, it can increase respiratory rate, no. It can decrease BP, no. It can increase heart rate, no. But it can, decrease heart rate. Okay, so why we have to insert the rectal thermometer carefully when we are inserting it? Because it can decrease heart rate. So when we are inserting the thermometer via the rectum, it stimulates the vagus nerve, okay, and it can decrease the heart rate, okay, which can be a big problem for patients with cardiac issues. So that's the reason when we are checking rectal temperature, we need to be very, very careful. Okay. The next question. While taking an adult patient's pulse, a nurse finds the pulse rate to be 140 beats per minute. What should the nurse do next? Check the pulse again in 2 hours, check the BP, record the information, or report the rate. What should the nurse do? The answer is report the rate. Okay, see, the pulse rate is 140 beats per minute. The normal pulse rate is 60 to 100 beats per minute. It is 140, that means the patient is having tachycardia. Okay, so immediately it should be reported to the clinician or the doctor so that the cause of it can be ruled out and the patient can be treated. Okay, why is he having so high heart rate? Okay, pain, even if the pain is there, it cannot be so high. There should be some underlying cause for it. Okay, and that has to be treated. Okay, so the nurse should report immediately to the doctor. That is the first action. Okay, next question. A patient complains of severe abdominal pain. When assessing the vital signs, the nurse would not be surprised to find what assessment? Okay, the patient is having severe abdominal pain. So when you're checking the vital signs, what usual findings you will find? Increase in pulse rate, decrease in body temperature, decrease in BP, or increase respiratory rate. The right answer is increase pulse rate. So when the person is having pain, the heart rate increases. Okay, decrease in temperature, decrease in BP, increase respiratory rate, this does not happen. These are not directly related, but severe pain can increase the pulse rate. Okay, so this is the common finding that you will find in a person with severe pain. The next question, the nurse is taking apical pulse. What equipment will be taken into the patient's room? So what equipment is required to check apical pulse? Sphygmomanometer, electronic thermometer, stethoscope or Doppler apparatus. See, sphygmomanometer is used to check the BP. Electronic thermometer is used to check temperature. Doppler apparatus, that is for the ultrasound, that is completely different. So what you require? Stethoscope. Okay, apical pulse. Okay, so you require stethoscope to check the apical pulse. Apical pulse, which is usually, it is not palpated, it is auscultated. Okay, so it is heard with the stethoscope, okay, for 1 full minute at the apex of the heart, which is on the left side, 5th intercostal space, mid-clavicularly. Okay, so you require a steth to measure apical pulse. Okay, it is auscultated, not palpated. Fine. Then the next question, 2 nurses are taking an apical and radial pulse and note a difference in the pulse rate of 8 beats per minute. The nurse would document this difference as which of the following? Pulse deficit, pulse amplitude, ventricular rhythm or heart arrhythmias. See, the last 3 options are completely different. The right answer is pulse deficit. Okay, the difference between the apical pulse and the radial pulse is known as pulse deficit. Okay, so it is usually calculated by subtracting apical pulse and radial pulse. Okay, so it is called as what? Pulse deficit. Fine. The next question is, before assessing respiration, a nurse reviews normal rates for adults. Which rate with the nurse identify as normal? That means here, see, directly they can ask what is the normal breathing rate, right? But they have twisted the question. Okay, so just they want to ask what is the normal breathing rate for an adult, for a healthy adult. Okay, the options are 1 to 6 breaths per minute, 12 to 20 breaths per minute, 60 to 80 breaths per minute. My god, it's too much. 100 to 120 breaths per minute. Not at all. Okay, so the right answer is 12 to 20 breaths per minute. For a normal healthy adult, the normal breathing rate is 12 to 20 breaths per minute. The next question is, a patient is having dyspnea. Dyspnea is difficulty in breathing. Okay, which would nurse do first? What would nurse do first? So if the patient is having difficulty in breathing, what is your first action? Remove the pillows under the head, elevate the head of the bed, elevate the foot of the bed, or take the BP. What will you do first? These 3 actions are not going to help. The right action to be taken is elevate the head end of the bed. Okay, so if you elevate the head end of the bed, what happens is the digestive organs, they descend down. Okay, and it will put less pressure on the diaphragm, okay, which is the respiratory muscle. So the diaphragm, what we say, you will have more space for the lungs to expand. Okay, so that's why if you elevate the head of the bed when the patient is having dyspnea, it will be helpful for the patient. Okay, the patient will have more ease. Okay, they'll be able to breathe with ease. Okay, so whenever any patient is having dyspnea or difficulty in breathing, the first thing that you do is elevate the head of the bed. The next one, a student nurse is learning to assess BP. What does the BP measure? So the question is, what does blood pressure means? Okay, what is BP means? Flow of blood through the circulation, force of blood against the arterial wall, or force of blood against the venous wall, or flow of blood throughout the heart. The right answer is, what is blood pressure, guys? Okay, the force with which the blood flows against the arterial wall. So this is the right answer, force of blood against the arterial walls. Okay, the next question, a nurse knows that the BP is often higher in older adults based on the understanding that which of the following occurs with aging. What happens with aging that the blood pressure of the older people is quite higher than the young ones? Okay, loss of muscle mass, changes in exercises level, decrease in the peripheral resistance, or decrease elasticity in the arterial walls. What happens? Okay, the right answer is decrease elasticity in the arterial walls. Okay, with aging, the elasticity of the arterial walls decreases, and this will have a slight increase in the blood pressure when compared to the adults. Okay, that is the right answer. Then the next question. A patient has a BP of 130 by 90 mm of mercury when visiting a clinic. What would the nurse recommend to the patient? Okay, you measured a patient's BP who visited the clinic, and the BP is 130 by 90 mm of mercury. So what will you recommend to the patient? Follow-up measurements BP or immediate treatment by the physician? Nothing, because the nurse considers this reading to be due to anxiety or a change in dietary intake. A change in dietary intake, no, it is not going to be helpful. Nothing, because the nurse considers this reading to be due to anxiety, no. If it is due to anxiety, it can be more than that also. Immediate treatment, no, it is not that high that it requires immediate treatment. Then the right answer is follow-up measurements of the BP. Because for a person to be diagnosed as hypertensive, they should have this higher blood pressure more than 140 by 90 for more than 2 to 3 visits. Okay, so persistent, they need to follow up the measurements of the BP in the regular visit so that they can rule out if they are suffering from high blood pressure. Okay, the next question is, a nurse is documenting a BP of 120 by 80 mm of mercury. The nurse interprets 120 to which of the following? So with BP 120 by 80, what is 120 here? It is pulse rate, diastolic pressure, systolic pressure, or pulse deficit. Very easy answer, right guys? It is diastolic pressure. So the numerator, yeah, 120 by 80, yes. So 120 is diastolic pressure, diastolic blood pressure, and 80 is systolic blood pressure. Okay, the next question. It is important to have appropriate cuff size when taking blood pressure. What error may result from a cuff that is too large or too small? When we are measuring blood pressure, the cuff size should be appropriate. It should cover at least 80% of the arm circumference of the patient. If not, what happens? An error, an incorrect reading, injury to the patient, prolonged pressure on the arm, or loss of Korotkoff sounds. Korotkoff sound, the sound that you are hearing when you are checking blood pressure, are called what? Korotkoff sounds. Okay, so what is the right answer? The right answer is incorrect reading. Okay, so if the cuff size is not appropriate, then it can give you wrong results. So the cuff size should be proper to check, to get accurate reading. Okay, the next question. A patient has intravenous fluid infused in the right arm. When taking a BP on this hand, what would the nurse do in this situation? See, if the patient is having IV fluids going from one hand, will you check the BP on the same hand or will you check the BP on the other hand? What will be your action? Take the BP in the right arm, take the BP in the left arm, or use the smallest possible cuffs, or report inability to take the BP. No, if we cannot report inability to take the BP, we have to check the BP. It's important to monitor it, especially when the patient is on IV fluids. Okay, so that we can taper it or increase as per the requirement. The right answer is take the BP in the left arm. If the left arm is good, in good condition, there is no fracture or no AV fistula on it, okay, then you can check the BP on the left arm. The IV fluid which is going, if the IV fluid is going on the right arm, you can check the BP on the left arm. Suppose if there is a fracture on the left arm, okay, and the IV fluid is going on the right arm, so which arm will you select? We don't have a third arm, right? So what we can do is we can stop the fluids, disconnect it, check the BP, and then reconnect it. Simple. Okay, if we check the BP when the fluids are on, it will be a problem. So that's the reason we have to stop it first. Okay, then next question. What is the medical term for fever? Simple. Hypothermia, pyrexia, hypertension, or thermophilia? No, it is pyrexia. Pyrexia is the medical term used for fever when the body's temperature is high, more than normal. The next question. What does pulse indicate? Pulse indicate heart rate, breathing, pressure in the arteries, or oxygen supply? Simple. It is heart rate. Pulse rate is, it indicates what? Heart rate, the number of time heart beats in a minute. The next question. What is the term for slow breathing? Okay, when the person is breathing slowly, what is it called? Bradycardia? No, bradycardia is decrease in heart rate. Tachypnea? No, it is increase in respiratory rate. Tachycardia? No, it is increase in heart rate. So the right answer is bradypnea, that is slow breathing, low respiratory rate. Okay. The next question. Body temperature is highest During what time of the day? It is in the morning or between 12 p.m. to 3 p.m., in the evening or during the night. Usually the body temperature is highest in the evening. The right answer is in the evening. Okay. The next question. If a patient has been drinking hot coffee, how long should you wait before taking the temperature orally? You have to check oral temperature. See, nowadays checking oral temperature, it's not commonly practiced. Mostly we go for the axillary, though it is the least appropriate measurement of the body's temperature, but still in view of infections and hygiene, we usually check axillary temperature. Okay, but oral is, yes, usually it is correct. Okay, so if you have to check oral temperature and the patient had hot coffee, then what will you do? How much time will you wait? 5 minutes, 15 minutes, 20 minutes or 30 minutes? 15 minutes is the right answer. You have to wait for 15 minutes. If the patient had any hot drink, you have to wait for 15 minutes and then check the patient's body temperature. Otherwise you will get wrong readings. Okay, incorrect, the temperature may be high, you will get a wrong recording. Okay, when measuring temperature, use what technique? Sterile technique, aseptic technique, standard precautions or contact precautions? It is not a sterile procedure, but yes, we need to follow standard precautions, okay, while checking temperature. Then next, where is temperature regulated? So which part of the body is regulating our body's temperature? Of course, it is in the brain, the master of our body, the control center, but there is a part called hypothalamus. Okay, so hypothalamus is the part which regulates the body's temperature. It is called the body's thermostat. Yes, and that regulates the body's temperature. Next question, what is the normal range of temperature? Okay, so if it is in degree Celsius, what is the range? 36.6 to 37.5 degrees Celsius, 34 to 36, or 34.6 to 36, or 35.6 to 38. The right answer is 36.6 to 37.5 degrees Celsius. Okay. For a patient with a temperature of 104 degree Fahrenheit, high, right, and a damaged hypothalamus, will you give antipyretic to lower the temperature? True or false? See, hypothalamus is a part in the brain which regulates the body's temperature. It is called body's thermostat. And here they say that thermostat, hypothalamus, it got damaged. Okay, and the patient is having high fever. So if we give antipyretic, it is not going to be effective. So the answer is false. We cannot give antipyretic to the person whose thermostat or whose hypothalamus is damaged and who's having high temperature. We have to go for the other measures. The next question, a patient has a radial pulse of 65, an apical pulse rate of 66. What is the pulse deficit? As we all know that the pulse deficit is nothing but the difference between the radial pulse and the apical pulse. So you have to subtract the radial pulse and apical pulse, you will get the pulse deficit. So 66 minus 65 is how much? 1. So 1 is the pulse deficit. It is minimum. Okay, minimum pulse deficit. Fine. The next question, what factor does not influence respiratory rate? Age, gender, smoking, medication, pain. See, all the other factors, they can affect the respiratory rate, but gender is not directly affecting the respiratory rate. So this is the right answer. Okay, it is not directly influencing. Yes, there is a difference between the respiratory rate of males and females, but still it is not directly affecting the respiratory rate. Okay, but other factors do comparatively. Fine. So gender will be the right answer. Next question, a person who is dehydrated will experience a low BP. True or false? See, a person who is dehydrated, that means the fluid volume in the body is low. If the fluid volume in the body is low, that means the person will have low blood pressure. So it is true. Okay, there is low fluid in the bloodstream. Okay, then the heart has to struggle more or beat harder to pump the blood throughout the body, and hence the person will have low blood pressure. So it is true. The most accurate and least accurate route for measuring temperature. As we all know that we can measure temperature orally, rectally, axillary or tympanic. Yeah. So there are different routes to measure the body's temperature. Which is the most accurate one? Most accurate is rectal. Most accurate is rectal, but it is not regularly practiced. Okay, because hygiene and chances of rectal perforations and discomfort the patient can have, and it can cause decreased heart rate. Okay, there are multiple reasons. And the least accurate route for measuring the temperature is axillary, which is most commonly practiced because from point of hygiene and infection, it is better, okay, comparatively compared to the other routes. That's why we add 1 degree to it, whatever we are getting the recording. Okay, so the most accurate is rectal, the least accurate is axillary temperature. Then before taking vital signs on a patient, what should you do first? Introduce yourself, close the privacy curtain, explain the procedure, or place the call bell within the reach. What will you do? The first thing before doing any procedure is introduce yourself. So this is the right answer. Before doing anything to the patient, first you have to introduce yourself, who you are, okay, how you are involved in the patient care, and then explain the procedure, what you are going to do, why is it important to do, okay, and then provide privacy and continue. Okay, so these are the steps, you have to follow that. Then the next question is, pulse rates are most commonly measured in at which site? Okay, what is the most common site of measuring the pulse rate? It is apical, brachial, carotid, or radial? It is radial. The right answer is radial. Radial pulse is the most common pulse site that we use for measuring. Okay, in case of CPR it is different. See, in case of CPR we use the central pulses, whereas normally otherwise we use peripheral pulses to measure the pulse rate. When taking a pulse, why should the thumb not be used? Why we should not use thumb when you are checking the pulse? The width of the thumb impedes an accurate thumb is not accurate feel for the pulse, or the thumb has a pulse and can be confused with the patient's. The sensation of the thumb is not as good as it is in the middle, or there is more dexterity in the fingers that is in the pulse. The right answer is the thumb has a pulse and that can be confused as with the patient's pulse. So that's the reason we are not supposed to use thumb when we are checking the pulse of a patient. What is the next question? Which of the following usually causes an arrhythmia? Arrhythmia is abnormal heart rhythm, yes. So defect in the electrical conduction of the heart, hypertension, inflammation of the vein, or low platelet. The right answer is defect in the electrical conduction of the heart. So when there is a change or something that is affecting the normal conduction system of the heart will have arrhythmias. Okay, abnormal heart rhythm. Okay. The next question, for an adult, which pulse rate is immediately reported to the doctor? 62, 46, 74, or 80? See, the normal pulse rate for a healthy adult is 60 to 100 beats per minute. So if you see here, all the other A, C and D are normal pulse rates. Okay, so the abnormal one is 46, which is low. Yeah, that means the person is having brady. Okay, so if the pulse rate is 46, it has to be reported to the doctor immediately. Okay, then how would you describe pulse when the patient, if it is not spaced evenly? Okay, so if the pulse rate is not placed evenly, how will you describe it? We'll describe it as irregular pulse. Okay, if the pulse is not at even space, then it is described as irregular pulse. The next question, the terms deep or shallow are most commonly associated with the measurement of which vital sign? See, deep and shallow are the terms which are used most commonly for the measurement of respiratory rate. It is not for temperature, BP or pulse, it is for the respiratory rate. We say shallow breathing or deep breathing, yes. So these are used for respiratory rate. The last question is, why are the vital signs recorded on a graphic record? Why we are recording it on a graphic record? Because it is a legal document or easy to record, or it provides vital signs, it can be taken easily. What is the reason? The reason is it provides a visual diagram of variations in a person's vital sign. Okay, this is the reason. So that easily we can note the variations in the person's vital signs and take the action immediately. And also we can identify the progress, we can know the prognosis or whatever the treatment or the procedure that we are doing, it is effective or not, that also can be known. So easily we can note the variations if we do it in a graphical representation. Okay, so I hope you all got 35 out of 35, because these were the most simple and easy questions, okay, related to the vital signs that we all know. But these will be helpful to you if you are preparing for quiz or any competitive exams for your nursing jobs. Okay, so as we all know, guys, that medical science is so deep and like a sea. Yes, that daily if we study something new also, still there will be a lot of things to study. So that's a reason, keep yourself engaged in learning something new every day. And if you like the efforts of Shehnaz in Nurses the Heart of Healthcare, please do subscribe my channel, like and share my videos, and keep learning and keep growing. Thank you so much for watching. Thank you so much for motivating me.